all right, so that we have a recording after we're done. And so if any reason you need to leave early tonight, of course, we'll be sending you the email link and we'll send it out to the entire list. We've got some great content for you tonight. Dr. M and Dr. Chip just do a fantastic job on these webinars, and they're going to be showing their screens here in just a minute. So let me prep Dr. M real quick. I'm going to make you host able to share your screen. And so first of all, just again, welcome everyone. Tonight we're going to be talking about the hidden pandemic behind the pandemic. And these are the ways that emotional trauma and other things can show up in your health concerns. You are going to hear from two great experts tonight that you know and love, Dr. M and Dr. Chip. They're of the Mladenoff clinics. Now we are recording. Make note that there's a chat box so you can drop comments to the panelists or to everyone. And also there is a Q&A box that you can ask your questions in, and your questions will be attended to by one of these two docs. And so as we work through, be ready to take notes. And of course, don't feel like you got to get carpal tunnel syndrome trying to write down everything. You can also, when the replay comes out, you'll be able to stop and pause as you need to take all the notes that you need. The main thing tonight is that you pay careful attention to what you hear and get the main concept so you can do immediate implementation for your own health. So with that, we welcome you. And of course, Dr. M, the floor is yours.
Thanks, Scott. Okay, I'm going to try and bring up my screen here. Okay, has that come through with our title page here?
Yes, it does.
It does.
Okay, great. Well, welcome everybody. We're glad you're taking part of your evening to join us. And we really feel moved about the topic this evening, because we've seen a lot of patients that over the past few months, one of three things happen. You've seen people who have reacted that have literally become paralyzed with fear. They can't move, they can't think, they don't know what to do, and their life is on pause. And then you get the other extreme of people that basically they don't give a darn, and they say, to heck with it, nothing, I'm not paying attention. And like, how can we have these two extremes of emotional reactions? And then you'll have some people in the middle just say, whatever it is, like, I'll do what I need to do and we'll get through. So we have three distinct reactions. And that's kind of the basis of what we want to talk about is, how do we emotionally respond to trauma? And yes, we're going to focus it on the COVID chaos, but this deals with any trauma in life. Okay, so Dr. Chip, my slides are not advancing here for some reason, so you're going to have to give me a hand.
Nope, those didn't work either.
Try your arrow keys, maybe.
Yeah, that's what I've been doing. And
left and right, or okay.
Okay, no arrow keys. All right, so let me just. Okay, so I can't see the screen, but can you see my screen?
No, your screen's gone now.
My screen's gone too. Okay, all right.
I might hit to share screen again, and let's give that a shot. Maybe you can have the controls.
Okay. Oh, it's asking me for a password and.
Okay, we see your screen.
Okay, you see it now?
Yeah, we see your screen now. So go,
okay.
Yeah, slideshow. Now do your
arrow
let
me try
keys.
Okay, there we go. All right, so my arrow keys are working. Okay, so like we've started our other presentations, I always like to start my presentation with, focusing everybody, and your intention, our intention is going to create the reality. So whatever your anticipation is about what we're going to present tonight, I want you to keep in focus of what you want to get out of this from the little bit we've shared to captivate your interest. So our intention of what we want to present is going to create the reality of how we take care of patients and how we can help you. So Dr. Chip.
So most of the information that you're going to see today is being presented to you by clinicians who have never treated COVID-19 and or the SARS 2003, the COVID-1. And so the information we're giving you is going to be the exact same thing. We're not trying to treat COVID-19, not trying to treat symptoms. Dr. M, if you could advance to the next slide for me, please. COVID-19 is serious. We've had a few people who tested positive, so we want to make sure that if you have any symptoms or you're feeling sick, you're going to the ER and you're doing what they tell you there. Okay, so that's the best thing about tonight. Dr. M?
Okay, so now as a backdrop, there's 4 great books, and we're going to send you this information, so you don't have to write anything down. So the basis of some of the things that we're going to talk about are from these 4 books. The first one is called Molecules of Emotion by Candace Perth, a brilliant PhD scientist. She was a female researcher in a man's world, and she was the one that found the opioid receptors of the brain in a man's world, and she was almost absconded from the research world, but she broke ground not only because of being a female in a man's world, but because of what she found. And so that's a great book that talks about every emotion is like a molecule of calcium or a red blood cell or a white blood cell. So that's a fascinating book. The next book is Trauma and Memory by Peter Levine. He's one of the leading authorities on PTSD. The next book is by Bessel van der Kolk, called The Body Keeps the Score. Now, this is one of the head researchers, a medical doctor who did all the research on Prozac, if you've ever heard of that drug, for depression and mind orders. And this book is really, I caution you, because this book, it will make you sick when you see some of the things that another human being has done to their children or other people. And the cool thing about this is, number one, the body keeps score, but number two, now this doctor who was the director of Prozac research says, don't do Prozac anymore. You need to do Rolfing, you need to do neurofeedback, you need to do chiropractic work, you need to do acupuncture stuff. So it's a pretty profound metamorphosis that this researcher went through. So that's a great book, but it does point out how vile and nasty things people do to each other. So I caution you on that one. And the fourth one is called The Polyvagal Theory by Stephen Porges. And this is a physiologist that describes, okay, how does the body respond to trauma? And so we're going to give you a little bit of something from each of those 4 books, but they are great reads. Some of them are available on Audible if you use the Audible or the audiobook platforms that are available too. So as we've been doing before, so if you type the word trauma to 555-888 on your cell phone, you're going to get some follow-up like we've been doing with our other webinars. And then tomorrow, Scott will send you a link to the page with all the research articles that we're going to talk about too. So just type in that word trauma on your phone, text it to 555-888. It's going to ask you for your first name, last name, and email. And then in about 10 to 15 minutes, you should start to get a couple of text messages with the links that we'll get to. So the bottom line is, in this hidden pandemic, is that every trauma leaves a specific mark in our nervous system. One of my mentors taught me, God will forgive you, but your nervous system will not. Your nervous system remembers everything that ever happened to you. Now, the good news is the overwhelming majority is on the unconscious level in our long-term memory, and that's where we want it to be. It's the problem happens is when it's stuck in short-term memory, and so you get a knee-jerk reaction. And that's what we're going to start focusing on, is this trauma mark that happens in your body.
So the next thing we're looking at is what everyone here at the Mladenoff Clinic and the Mladenoff Clinic in Arizona, for all of you that go to Dr. Diana, we look at the triad of health. So we're looking at your whole body and not one part. We're looking at chemical, physical, emotional. We're looking at everything. And so that's why sometimes we're using neurofeedback. We're using chamber for our people here in Kansas City. We're doing lots of different things to make sure that we look at every single trauma that your body's ever had.
All right, so now we played this game last time about being in control of your life by predicting the future. So I want you to play along with me. I'm going to ask Dr. Chip. He hasn't seen any of these pictures that we're going to talk about. So well, let's just see how you would react. So you answer to yourselves. If you're watching with someone, I know Julie and M. John are watching together. Hopefully you're watching on the same box. If not, you wave to each other from the other room. So here's the questions. If you were hiking with your friends and you got lost and you ended up by yourself and you're coming down this mountain pass, and then all of a sudden you turn the corner and lo and behold, there's a mountain lion coming up the pass. What do you predict is going to happen? Dr. Chip.
Either you're going to turn and run or it's going to jump on you.
Okay. What about when Japan attacked Pearl Harbor? What do you predict, Dr. Chip? Does that mean anything to you, or is it just a footnote in history?
No, it would mean that America is going to have a, we'll call it a violent reaction, but they're going to have a reaction.
Okay, but did you have a violent reaction when I showed you this picture?
I had a skip and a heartbeat. Yeah.
A little twinge. Okay, so now what would the people who were there or people who had relatives there, because I was born after this event, so I have a different emotional reaction than to some of the people that are online right now that remember this day in infamy, as the president said. It's like, so what kind of emotion would that stir up in you?
It
Okay,
would
so
probably
now,
stir up some fear, some anger.
okay, so what do you predict people would react to this picture? If you don't know what that is the train entrance to the Auschwitz death camp. So what do you predict some people would react to that?
Some anger, some sorrow, some fear.
So would it be fair to say a Jewish person might react a whole lot differently than somebody from Canada, which is I am from? Even though this is appalling, but there is a trauma mark on the entire earth about this time in history. But is there a different mark for the Jewish people because of
There is.
this? And the answer is yes. Well, what about this? When the former Soviet Union crushed the Czech revolt in 1968, what do you predict those people would be like?
They could have some joy depending on which side you are, or most likely more fear, more trauma, maybe a
More,
little PTSD,
more hatred.
more hatred. Yep.
More hatred. So Dr. Chip is familiar with this a little bit because one of his favorite hockey players wore number 68 as a tribute to this event when the Soviet, and he was born after that, obviously, but so Dr. Chip really admired this player, but that's why this player wore 68, was to remember this time when the Czech people revolted and the communist bloc literally crushed them like ants. Okay, so this is Tiananmen Square in the 90s when the Chinese communists literally assassinated their own people. What do you predict would happen with this, Dr. Chip?
Extreme fear.
Extreme fear. So what would people do? How would they react?
They would most likely have an increase in heart rate, decrease in breathing or ability to hear different sounds.
Okay, Dr. Chip, would they run away or would they stand up and fight? All that other stuff's going to happen, but like, what would they do? Would they become paralyzed and just say, I don't know what to do. I don't know what to do. I don't know what to do. Or would they turn around and run like heck? And the answer is it didn't matter because they were machine gunned down by the Chinese communist military like ants. So what kind of scar does that leave with the Chinese people or the rest of the world?
A big one.
Okay, so does anybody know what this picture is? Did I have to put the date up there? And so what emotion does that stir up in you? And the answer is, I think all of the participants today were born before this. So that's September the 11th. And so there is personal emotion. As soon as I flashed this thing up, you probably remember where you were at that time of day. I was seeing a patient, and this patient came in and said, it was about 9 o'clock. And the patient said, oh, they just bombed the World Trade Center. I said, oh, no, are you kidding? They just, that's TV. You believe everything you watch on TV, and lo and behold, the next 20 minutes, news started coming out. And so my first reaction is, oh, don't believe everything you hear on TV. And then the rest is history. The rest is history. Okay. So now, what do you predict would happen if you've been watching the news every day for the last 3 months? And here we've got the official cases as of 29th of March, when you see this many positive findings, this many people dead, this many people hospital. What do you think would happen to people if they keep hearing this pounded into their brain every hour of every day for the past 3 months, Dr. Chip?
I think that's why we're seeing some of the fear that we're seeing today.
We might see some scars, and we might also see some people say, okay, so I want to just stop sharing for a moment. No, not yet. Okay. So if we keep getting this pounded into our brain, is it easy to understand why some people would become paralyzed with fear and not know what to do? And, oh, woe is me, I don't know what to do. And like, who should I turn to for information? Or other people might say, oh God, don't believe that stuff. They're all crazy. And it's like, I don't believe a word they say. And then you get some people that say, you know what, it is what it is. I'm going to do what I do to react. And so we have people that become immobilized, they become mobilized, or they're just, nice and relaxed and kind of go with the flow. So what do you predict would happen when we saw these videos a week ago of the city of Minneapolis burning?
It depends on your philosophies, but a lot of people got even more scared.
So they would become immobilized, they would become mobilized, or they just say, it is what it is, right? The same three reactions. So how does why does the body do this, Dr. Chip?
It's
So
a
hold
great
on.
mechanism to protect ourselves.
Excellent. One more slide. Okay, so now what do you predict if children see this image every day? Whenever they go out, they see people walking with masks on. They can't see their faces. They can't recognize who they are. Is it my grandmother? Is it my neighbor? Is it my friend? Are they laughing? Are they happy? Are they sad? Are they crying? What do you think is going to happen to children and us adults too if that's all we see?
One of those three.
It might leave a trauma mark, wouldn't it? Okay, so that's the context of where we're headed to this evening. And so here's the big question is, how do we react to these threats, whether it's the mountain lion coming down the path that's meeting you, whether it's, you're in Tiananmen Square and the military's pointing rifles at you because of a communist regime, or you're faced with all these people who are wearing masks and you don't know who they are, or your property next door is being burned and looted. So how do we react to that? And the answer is, we're hardwired for a connection to this kind of activity. And so three things happen. The first thing is you become immobilized. Okay, so now here's where I want to stop my screen for a second. Okay, so can you see me, Dr. Chip?
Yes.
Okay, so what happens, you come around that corner and the mountain lion goes there, you're going to go, right? You're going to go a little pause. Now, you don't have time to think about this. This just happens automatically. That's what we're hardwired for, right? So you go, and then now you have to figure out, okay, is it a threat? Is it okay? How do I proceed? Okay, so I wanted to just show you that. That's automatic. That's the knee-jerk response we have. And hopefully I can get my slides back here. Okay, there. Is that coming through, Dr. Chip?
No, it's still on you.
Still on me, okay. Does that come through now?
Just hit the share screen at the bottom and then select your slides.
Oh, there we go. Thank you. We got a little bit of a technical problem. No, it's asking me for an email, Scott.
No, I can see your screen. There you go.
Oh, okay.
Yep.
Never mind.
All right.
Okay, so the first thing is we become immobilized. So the next thing is now we become mobilized. We either fight or we turn around and run. And then the third thing that happens is we have social engagement. We feel calm. We calm down. Okay, so here's what happened to me when people hear about my bike wreck that I had about just over 3 years ago. They asked me, well, how did you do? Have you driven by the spot where you got hit and everything? And so here's what happened. I got hit and I was immobilized, but over the next 72 hours, I kept telling the story about how I got hit. And so I became mobilized and trying to help myself get better with Dr. Chip's help. But because I related the story over and over and over again, and I realized, okay, I'm not dying, I just got a few problems, then that memory went to long-term memory. And so the next question people ask me is, well, do you have nightmares when you ride by? Have you ridden your bike by the spot where you got hit? And I say, yeah. It's like, no problem. I never had any nightmares. I've not had any nightmares about the accident. And it's because I talked about the accident. I realized it was not life-threatening. I could deal with the injuries with Dr. Chip's help. And so when I came to that calming down, it then was transported into my long-term memory, so I don't have that knee-jerk reaction when somebody says, you can ride by that spot, okay? So Dr. Chip, give us a little more details about how that works.
So when we look at this, we have our immobilization there in the red, the fight in the yellow, and then the kind of rest and digest in the green. So obviously the stoplight here that we have, unless you're colorblind, the gentleman on the left is the red, and the gentleman on the right is the green man. Not the Vancouver Canucks green man, if any of you are hockey fans, but it is a parasympathetic green man. And so as Dr. M goes to the next slide for me, we are hardwired for that connection. So when we look at the polyvagal 3 circuits, we have the immobilization, that red box, right? We have the threat feels life-threatening. You have a collapse or a shutdown, and that's the person who faints at the sight of blood. You have unhealthy coping behaviors, drinking, illegal drugs, and or just nefarious behaviors. You have despair and hopelessness. The next one is the mobilization, so that fight or flight. We have, usually you're in a heightened sense of awareness, so you cues to threat or danger. It is related to chronic stress and anxiety because it's that fight or flight response. And so you have a greater conflict in relationships because you're always on your tiptoes, you're always waiting for the next stressor. And so you never calm down. And so the third one here on the next slide is that social engagement. This one is a safe connection between family, friends. It's really that calm, regulated, healthy balance of everything that you're going through. You are resourceful, and it's just basically making it a easy life to go, hey, I need to calm down. I'm going to calm down for a few minutes and regulate yourself. Scott and I were talking about sleep before this. Sleep is one of the best ways. And then now it's, okay, I need to get back into that mobilization to work on whatever's coming at me to go back to that social engagement. And so it's working through these 3 that gives us the heart rate variability that we're going to talk about in a little bit.
So the key is, the key is like, okay, how can we get to that safe zone, to get to that green state of being calm, cool, collected, where you feel safe all the time. So I'm going to go through a little bit of brain stuff here real quick. And so the way we connect our threats to safety is 50% from our upbringing, and 50% of our upbringing is we had good enough parenting that our parents taught us some things. They would, teach us, okay, well, here's what that means, and here's, why this happened, and would guide us through life. But what about the other stuff? So we have a negative built-in bias in our nervous system. So trauma, neglect, abuse, they are all cumulative, and they're stored in our bodies, and they negatively impact our health and our happiness. So it's all managed through the automatic nervous system. It's really called the autonomic nervous system, but I like to call it the automatic because you don't think about this. It just happens automatically. If if you're having something to eat right now and it's protein, you don't have to think about how much protein digestive juices your stomach has to make to break it down. Or if you're having an adult beverage that's a little more carbohydrate intense, you don't have to think about making some stuff to break down the carbohydrates and help your liver manage the C6H12O6 content, which is, for those science wizards out there, the alcohol content of your adult beverage. So you don't have to think about that. It happens automatically. So it's our automatic nervous system. And so it's a memory-based system. Our body remembers everything. Remember, God will forgive you. Your nervous system will not. It remembers everything. So these memories and their automatic and physical effects are accessed and altered by lots of different methods. So what happens is the part of our brain called the thalamus collects and organizes stuff from our eyes, our ears, our nose, our throat, our skin, our mechanical receptors of our body, and it stores this information for this event. And so one of the things I remember, if you were a fan of the MASH TV series, Hawkeye started sneezing like crazy all the time, couldn't stop sneezing, itchy nose, itchy eyes, and they couldn't figure out what it was, so they brought in a psychologist. The psychologist was able to figure out he couldn't save this patient, and the patient came in a burlap sack, and the smell of the patient's body, and Hawkeye couldn't save him, created one of these trauma memories. And so fast forward a couple of years, when he had that same smell affect him, he had an allergic reaction, but all that stuff was stored in his eyes, his ears, nose, skin, mechanoreceptors in his brain. And he had that knee-jerk reaction when he had that smell. So we have this coherent experience, and it goes to the brain, called the amygdala. If you're familiar with that, the amygdala is the rage reaction. Dr. Chip's going to talk about that in just a minute, but the amygdala gets its information, and it's helped by the hippocampus, part of the brain, like right deep down the center of the brain, that relates experiences to past experiences. What does this event today have to do with anything that happened to me before? Okay, so what does the lockdown of COVID have to do with 9/11? And the answer is they're both lockdowns, planes stopped flying. Okay, if that 9/11 experience is in your short-term memory, you're going to have the same knee-jerk response. If you process that information, it's in long-term memory, and you've dealt with that, then you're not going to have that knee-jerk response. And again, we're going to explain that in just a minute. So our experiences will send a message that orchestrate the whole body responding. It's not just a itty bitty little bit, it's our whole body responding. And so this all happens, and the body is put into movement. Your body reacts before your brain knows what happened. And so that's the person where you say something, you might say this to your spouse, and before you know it, they're all in an anger fit, just yelling and screaming and throwing stuff at you. You say, like, what the heck just happened? What did I do? And it's this knee-jerk response. It's uncontrollable, but you triggered some memory that has that automatic response. So Dr. Chip, can you talk to us a little bit about that immediate response, so before your brain even knows what's happening, that you respond instantly?
Yes. So the biggest thing here is the hypothalamus has these stored trauma memories. And so the amygdala is the center of that limbic system, which is the emotional system. So what happens is we get hijacked by that as a mammal, and then we don't have a chance to make rational decisions. So the hardest thing to do in that situation is to stop, take a breath, let your body go back into that green safe zone, because you don't even know it's happening. And so that's where some of the things that Dr. M and I are doing now, testing people as they come in, we're trying to get them out of this rage response right here that you see. This is out of Netter's. This medical doctor, as you can see on the bottom left corner there, he did all these amazing pictograms, essentially, and it shows you here, I don't know if you can see on your screens, but if you've ever seen someone at the gym with some roid rage, or someone in their car in traffic that's just extremely mad, they get that forward flex posture, and nothing you can do for an undisclosed amount of time can get them out of that posture. And so it just keeps feeding their limbic system and their amygdala until they either get back into that safe zone, someone calms them down, or in a road rage or roid rage, someone knocks them out. And then their brain shuts down and resets. So what we're going to try to do on the next slide, Dr. M, thank you, is this polyvagal theory again. We're going to start at the bottom on this one. We have that passive protection system. We have the immobilization, which is still that red zone, which is the parasympathetic dorsal vagal complex. Really complicated words for decreased arousal, frozen activation, decreased heart rate, dissociation, frozen, that collapsed, or when someone goes limp. So that is a protective mechanism. Then we have the yellow, the danger, which is the aggressive defensive system, which is the fight or flight or the sympathetic. That is increased arousal, increased heart rate, increased stress, increased fear, anger, aggression, rage. That's where most of us are going to get stuck. And we'll see here in a second, our HRV tells us exactly where we are on that. And then the green is the safe zone, that social engagement system, signaling for emotional motion, communication. It's that parasympathetic ventral vagal. It is optimal relaxation, activation, rest and digest, eye contact, facial expressions, and voice. So if you are in a heightened sense of awareness, you actually have a decreased frequency that you hear at. So you hear more low tones than high tones. So if you've ever thought about, we'll just use this as an example. You've ever seen a kid that's crying and the mom picks him up and he immediately stops crying with that high voice, it's because the child feels safe with the mother. If the father is yelling at him, don't do that, it's creating that life-threatening or that red or even the yellow margins here. It's getting into that danger zone. And so it throws the kid even into a more panic. And so Dr. Porges says someone who can get into a higher tone will put you into that safe space. And so there's different ways that we can do that we'll talk about in a few minutes.
Okay, so here's what happens when there's a traumatic event. So look at this chart. If you follow the green line, so we have the yellow triangle. Can you see my pointer, Dr. Chip?
Yes, we can.
Okay. So we have the traumatic event here. And so what happens is we go through that little pause and we figure out, okay, is it safe? Is it danger? Is it life-threatening? And then we respond accordingly. And so then we should calm down after we've resolved the situation until we have another event. Well, what happens if we follow the black line now? This traumatic event is pretty strong. Like some of the pictures we went through, and now we get this, we blast and we figure out, okay, this is not good. This is dangerous. I have to, stand up and fight or turn around and run as fast as I can to get away from this danger. And then what happens is you crash and burn. Well, you haven't gotten back to the green zone. And so now you're stuck in either the red zone or the yellow zone, either the immobilized or the immobilized anger zone, right? And then you have another traumatic event, and so you get another spike. Well, what happens is you can get stuck in the on position. You're stuck at the traumatic event that you're always in that yellow zone where you're mobilized to fight, or you're mobilized to run away, but you're mobilized to do something, okay? And equally, what can happen is if you have enough of these things happen, you've heard of this in a fibromyalgia patient, okay? They've had enough life events where they're just plumb exhausted and they're stuck on off all the time. And so they're depressed, they're lethargic, they're exhausted, they're disoriented, they're disconnected. Sometimes they can't even have a coherent conversation with people because they're stuck on off all the time. So if you're stuck on, or if you're stuck on off, then when a traumatic event happens, like this COVID-19 that we are continuing to go through, how do you think you're going to react to it? So, Dr. Chip, I got a question for you. Do we have any stats on how we as a society are responding to this trauma of the COVID? And where are people reacting? Are they stuck high? Are they stuck low? Are they kind of hanging in there and going with the flow? So give us some of those stats and any data that you've been able to track down for us.
So if you go to the next slide for me, this one, we have two different studies. The first one from April 2nd, obviously that was kind of in the thick of it. And so I'm going to try to run through these real quick and just hit the highlights. So if you, next slide for me, Dr. M, please. So you can see most Americans across the demographic group say that their lives have been disrupted by coronavirus. The total is 45 is a lot, 45% is a lot, 27% is some. So 72% of the population says it's in some way disrupted their everyday life, right? So, and then you can see the breakdown here, men and women. Women are feeling it a little bit more than men. The Black population is a little bit more, but when we look at the white population has some at 33%. So overall, we're seeing that every single group here, parents, 49% of parents of children under 18, I mean, they became homeschool parents right away. So this page right here shows that 75 to 80% of people are affected in some way. If you go to the next slide, the majority of the worst is yet to come. Remember, this is April 2nd. They were not wrong. If you go to the next slide, we have their investments will negatively be impacted over a long period of time. We had 59% of that. We have risk of exposure, that they can't afford to stay sick at home. And a lot of people have been able to work from home, but I know me and Dr. M can't work from home. So we have to look at things, and we already talked about how to protect yourself, but there are a lot of people that cannot afford to miss a day of work and maybe don't get sick days like we don't. And so that's one thing that COVID-19 has once again affected us. If you go to the next slide, 4 in 10 report a lost job. I mean, we weren't able to find exact data for April 2nd, but we know that unemployment has skyrocketed. And I know we all know at least one person, probably even more than one person, that's lost their job due to this. And then if you run to the next slide for me, thank you. The larger share now reporting, now if you look from March 11th to March 15th, it was a minor impact. March 25th to March 30th, it's starting to get more of a major impact. On the next slide, and this is all from one study. This is just one study. And once again, this one is the demographics of the impact on their mental health. So now this is what we're talking about tonight, is your mental health. How can we get you back to normal if you are in one of these groups here? On the next slide, it shows the report about unable to get medical care. We know a lot of people that were not able to go to regular checkups because they're worried about personal protective equipment for healthcare workers. Some places next door to us was completely closed down. He could not do perform any of his procedures. That's a major thing right there. That's another issue. And so now here, our next one on April 21st on the next slide. Oh, I skipped a slide too early. Thank you, Dr. M.
Okay.
And then medical care unrelated to coronavirus. There are a lot of people that couldn't even get out to get regular care. We were lucky enough to stay open and to help people as we could go through, but then we joked with a patient this morning that luckily we had some thermometers, because as soon as everything hit, you couldn't find a thermometer to save your life. As well as cleaning supplies. Please nobody have the freeze reaction when I say toilet paper, right? That's one thing that everybody kind of went, uh-oh, nobody thought about toilet paper. And then the big one is the prescription medication. And so on the next slide for me, Dr. M, now we have the April 21st, and now we're looking at mental health and substance abuse. So now we're a couple weeks later into this, and a lot of people had a major negative impact on sheltering in place. And then we have, let's see here, 47% had any impact on staying in place. And then we had 37% of people that did not shelter in place. Next slide for me, Dr. M, if you look at, these are stats from 2016 to 2018 of adolescents ages 12 to 17. And you see that 12% there already has current depression and anxiety. How much do you think that went up with now not being able to see their friends, not being able to go out and do much other than walk or hang out with parents? Sorry, parents. But I know you guys feel the same way about some of your kids too, when you get cooped up for 3 months and can't do anything. On the next slide, we have, again, 26% have a major negative impact because they've lost their job or decreased income. 54% total have had an impact in that. And then 40% have not lost their job or income, which that's obviously lucky, but that 54% is huge. So we have to make sure we're helping them. On the next slide, we have adults who say they worry or stress related to the coronavirus has had a negative effect on the household income. And now we're looking at exact dollar figures, right? If you make less than $40,000, 26% is a major percentage there. And then you have 50% of people making less than $40,000 have been impacted. 40 to 89,000, you have 42%, and then 90+ thousand even still has 43% of people affected because of the coronavirus. And on our last page here, Dr. M, we have people who say this has had a negative impact on their mental health. People who had excellent or very good health had a major negative impact. That right there should scare a lot of people, but there's something we can do about it, and we're going to talk about that. So we want to make sure we're also looking at the only fair to poor health, because that is a still major group. Even though it's a lot, it's not that much more when we look at percentage-wise, it's still a lot of people that each and every one of us know. And so we're going to look at the next slide again. As Dr. M said, if you get stuck in that on position, we're going to see issues of anxiety, panic, hyperactivity, inability to relax. That could be the person who's always on the go and never takes 5 minutes to relax. Again, you could have symptoms of stuck off, depression, lethargy, exhaustion, chronic fatigue. They're stuck in the off, and we need to help turn them on properly.
All right, so now here's the question. Why are those two studies important? Well, you saw some of the results. We're going to send you a link to those two studies so you can download them. They're directly from the CDC. The group that did those studies is called the Kaiser Family Foundation. And the reason why this is important is the Kaiser Foundation did what they called is the ACE study from 1995 to 1997, where they evaluated 17,000 HMO members in their insurance group, and they asked them 10 simple questions. They were non-invasive questions. And so this was a landmark study because this is a study about the emotional welfare of people, and it's not talking about the ghetto. It's not talking about the other side of the tracks. This is talking about affluent society and your neighbors and our neighbors, or maybe you and I. So what I'm going to ask you to do is, again, if you can write down, send a text to trauma to 555-888. We're going to send you those 10 questions, and we're going to talk about them shortly. But what is that ACE study all about? So the ACE study is how do you relate to toxic stress? So ACE stands for Adverse Childhood Experiences, and they can include things like physical and emotional abuse, neglect, caregiver mental illness, household violence. The more ACEs a child experiences, the more likely they will suffer from things like heart disease, diabetes, poor academic achievement, and substance abuse later in life. So toxic stress explains how ACE gets under the skin. So experiencing these adverse childhood experiences, as well as things like racism, community violence, we're not seeing any of that right now, are we? Without support from adults can cause toxic stress. And now let's look at what some of these toxic stress ACE things can do. So we can reduce the effects of this ACE toxic stress by doing several different things. We can develop responsive relationships between children and their caregivers, their parents, or the caregivers if they have to have ancillary care where parents work at a different location. There has to be core life skills, and there has to be some specific nutritional things that are done to care for all of us, not just the kids. So here's the outcomes of this ACE study. What they found was the people's behavior would change. They would have a lack of physical activity. They would start smoking. They slipped into alcoholism. They had drug abuse, and they missed work. Does this kind of sound like the last 3 months? It's like we all joked here. We said, okay, what's the first thing you're going to do when we get open up and we get to go back? Are you going to go to AA or are you going to go to Weight Watchers? But that's not a joke. Because that's what happens with these adverse childhood experiences, that these things happen. In a little more detail, it has been, these childhood experiences have been linked to obesity, diabetes, depression, suicide attempts. By the way, we had a patient come in who lives near Leavenworth, Kansas. They own a farm, and she said the amount of suicide calls and the suicide rates in that county has gone up dramatically. She is friends with the head ER physician at the hospital up in Leavenworth, and they are just being inundated with suicides and alcohol toxicity syndrome from people drinking too much because of this COVID lockdown. Heart disease, cancer, stroke. I mean, you can read the things that are on there. Physical and mental health is adversely affected by these emotional traumas. So let's look at the risks. So here's what the ACE study reported, that, okay, on the viewing left, you see 0, 1, 2, 3, 4. Well, 0 means those people had no ACEs reported from that questionnaire. So they found if you had 4 or more ACEs, 16.5% of these people were smokers. If you had 4 or more ACEs, over 18% of these people attempted suicide. If you had 4 or more ACEs, you experienced 2 or more weeks of depression in the past year. Look at that. At only 1 ACE, 1 adverse child experience, there was a 21% rate of depression for 2 weeks or more in a year. That number is scary. It is totally scary. People that have used illicit drugs, okay, if you had 1 ACE, 11.4%, 3 ACEs, 21.5%. These numbers are very scary. What about alcoholism? 1 ACE, 5.7% of them were alcoholics. If they had 4 or more, 16.1% were alcoholics. What about obesity? Well, if you had 1 ACE, 7% of those people were obese. If you had 3 of them, 10.3% were obese. So now what they did was they took that original 10,000 people, and this organization called childtrends.org, they repeated this study, those 10 questions throughout the country. And here's what they found. They broke the country down into several different regions. So let's just look at the Midwest. And here's what they found in our region. Obviously, there's more than just Kansas and Missouri, but you see in the upper column where it says West, North, Central, it says white NH. White NH is the race, and NH means non-Hispanic. So look at those. Every race, every ethnic background was affected by at least 20%, just the Asian non-Hispanic at 16%. That's a lot of children affected with just one adverse childhood experience. Okay, so now here's with 2 or more. Again, let's just look at our area right here. 2 or more adverse experiences, and you see those numbers are still pretty high. We're talking 20%, and then other non-Hispanic. So what could that be? That could be Native American, Native tribe people at 39%, Hispanics at 27%. That is a lot of adverse effects on children with 2 or more ACEs. So here it's called COLEVA, Consequences of Lifetime Exposure to Violence and Abuse. And all of those neurological conditions, we're going to send you this list of stuff as an outcome. So now I'm going to ask you to do that 10-question questionnaire. And you're going to see how many ACEs you have. And now we're going to ask you to do a couple other things with all of the stuff that's happened in the past 3 months. If you and we don't help you get a handle on this, this is where you're headed with your health. These are things that can happen to you because of the emotional trauma mark that's been embedded in your brain and in your central nervous system. Okay, so here's what happens. And this is right from that ACE study. I'm going to just circle this. These are the things in the bottom. Okay, so you see early the top of this pyramid, but these adverse childhood experiences, okay, and notice the very bottom one, historical trauma. That's why I went through some of those slides. So now this COVID crisis is part of that historical trauma. It's a generational embodiment. What person on planet Earth does not know about the COVID-19 disaster? And the answer is probably some of the Aboriginal tribes of Australia, maybe some tribes in the deep Congo, maybe some Eskimos in the Northwest Territories. It's going to be very few people who basically, and I also have a doctor friend of mine who says they're in Iowa and they don't use technology. They use horses and buggies and Amish, thank you very much. I don't know why I drew a blank on that. Okay, so they have no technology, so they are clueless about this, right? So there's very few people. This is a generational trauma that is going to impact us for generations to come unless we get a handle on this emotional thing like today, right now. Right, so here is the early adversity that has lasting effects, starting with traumatic brain injury, fractures, to depression, anxiety, suicide, even unintended pregnancies, cancer, diabetes, alcohol, drug abuse, and education has been radically upset and changed. Kids not having graduation, kids not knowing if they're going to college. I have a dear friend of mine, his daughter's on a volleyball scholarship. She doesn't know if she's going to even play volleyball ever again, if they're going to even go back to school to play volleyball. And she had a 4-year full ride to go play volleyball. She has no clue what's going to happen. This trauma is affecting every strata of society. All right, so this poster in the background is what the CDC says we should do about the emotional trauma. As you see, that's not a very big list, and it's pretty nebulous, and it's like whitewashed. So here's the question. Are you stuck in trauma mode? And so again, keep this in mind. Are you stuck on? Are you stuck off? Or are you kind of in that green flow? So remember our 3 guys, we'll call them like the blue man group. We got the red guy who is immobilized. He's stuck. He goes, the yellow guy is figuring out, okay, mobilization. Do I fight? Do I turn and run? Okay, and then the rest and repair guy is the green guy. So which one of those are you? And as we go forward, Dr. Chip, let's start delineating some of these things. We're going to start bringing it home now.
Okay, so the immediate action required, right? We're going to send you the list. We're going to make sure that you fill out that form, and then we're going to figure out what we need to do. If you remember this from our first webinar, it's Bruce Lipton, and we're going to send you this link as well. We need you to watch that, and we want to make sure that you get all the information from it. Okay, we'll make sure that's sent out. Just text the word trauma to 555-888.
Okay, so the first thing you're going to do, we're going to send you the link. If you texted the word trauma to 555-888, if you did that already, you should already have that link to the ACE test questions. Of just 10 questions. Download it, print it out, answer them. You either answer true or false, add up the number of trues, and then call us, or next time you come in, bring in the form. Okay, remember, one ACE has an adverse effect on children, so don't minimize, don't blow it off and say, well, you know, that's really not, don't minimize it. Be accurate, be truthful to yourself.
Next thing we're going to do is, last time we told you to stop watching the news, but this time we're going to tell you to stop watching negative and violent TV, videos and pictures. So a lot of kids like video games that are pretty violent. There are a lot of violent TV shows on now. We're going to have you stop watching all of them for the next couple of days to try to let your body and mind reset. The next thing we're going to do is we're going to journal our fears and concerns. Just like Dr. M started this off with, once you get the fear out, it becomes less fearful. The more you talk about it, the less fearful you're going to get, so the less reaction you will have.
All right, the next thing I want you to do is we want you to get a specific trauma stress test and a polyvagal physical exam. So those of you that have come into the office, you see we affectionately call them our battery cables, where we put a sensor on each wrist, and we measure the space in between 300 heartbeats, and that's called heart rate variability. And so this can tell us what stage you're in. So Dr. Chip, let's see how you can predict how these patients are doing. And so we're going to ask our viewers to watch this too. So this is the stress score. Which piece of the pie the 3 pieces of the pie should be about the same size. So what do you think this person is stuck in, Dr. Chip?
They're going to be stuck in that freeze mode, or basically the faint.
Right. So they're immobilized. They're paralyzed. They don't know what to do. By the way, this was me about a day after my bike wreck. So my body was stuck in freeze and faint mode. Even though I had figured out, okay, I'm not dying, my body was still on red alert. So that test gives us this printout instantly when we do this test. Okay, so stuck in faint, freeze, immobilization. Okay, what about this person here?
They're going to be stuck in that same immobilization.
Okay, this is a patient with rheumatoid arthritis, an autoimmune disorder. They're like this all the time. So they're stuck in that same faint or freeze motion. And if you look at some of these patients, if you look at our elderly population and they look like that red guy on your viewing left, they're stuck kind of hunched over. Guess what? They're stuck in freeze and faint immobilization mode. Their body is screaming what's wrong with them. And this simple test, in 5 minutes, we can figure this out. Okay, Dr. Chip, what do you think this person is? Where are they at?
Stuck in that mobilization or fight or flight.
So they could have a short fuse, couldn't they? It's like they instantly react to anything, and it could be reacting violently if they're stuck on, but if they're stuck on off, it could be, who cares, right? So they're stuck somewhere, but they're stuck in either fight or flight or running away. So that's pretty easy, and that's pretty cool that we get this instantly from this test. So they are stuck in mobilization mode. Okay, Dr. Chip, what about this person?
This person's going to be in that social engagement, or better known as the rest and digest.
Okay, but that green part of that pie is awful big. Is it supposed to be that big?
No, it is actually a little too much.
Okay, so this is a rare person. Most people are stuck in one of those other, you're in the red immobilization or yellow fight or flight mobilization mode. So this person is stuck on their give a darn gauge is on zero. They're like, the classic hippie, if you will. It's like, oh yeah, everything's cool, nothing, no worries. It's like nothing irritates these people, and they never get anything done. They're just like, you get the picture, right? So that's going to be our too much. So the ideal situation the ideal situation is we want to have the three pieces of the pie be about the same size. So it's pretty cool from that test that we can tell where you're at on that emotional trauma scale. And then we can start figuring out, okay, what has to be done to figure out how to balance these? Do we need to do some structural work? Do we need to do some nutrition? Do we need to do some acupuncture? What things need to be done? But we want you to be in a balanced emotional state. And this is pretty cool technology that we're inviting you all to come in. If you haven't had it done recently, come on in on the house. We want to do this test on you. It takes 300 heartbeats. That's like maybe 5 minutes, plus or minus, depending on your heart rate. And it's pretty simple to do.
Then we're going to talk about specific treatments. We're not going to talk about those tonight, but we're going to circle back to the chemical, structural, and emotional, that whole body approach. This is just one piece that we use here at the clinic and Dr. Diana uses in her clinic. And that's what's going to help us to shape your specific care plan. The other thing that we're going to do for everyone at home, we're going to do if you have not downloaded it already, if you have, keep using it. We know it's helping. You need to use it daily. That's the big part, is we've had a few people who've had issues. So thank you for bringing that to us, because we're taking it right to them. But you can download it to do 2 different iOS or Android devices. If you take a picture of your screen, I'll have Dr. M leave this up for just another minute or so. If you take a picture of the screen, and we will send you this as well, it gives you that 15 days free, no obligation. But what this is going to do is it's a form of neurofeedback. You don't get the feedback, but if Dr. M, now you go to the next slide for me, we're going to start talking about how to relax, right? So in less than 20 minutes a day for 1 session, 40 minutes for 2 sessions, you can start to pull your brain out of that mobilization or pull it out of the immobilization. And that's something you can do daily at home. How do they do it? If you go to the next slide for me, Dr. M, it's a brainwave symphony, right? We have starting on the top left, we have the betas, which are awake and active. We have going to the right, we have the delta, which are deep sleep and recovery. We have the theta, the healing, the super learning. And then we have the alpha and gamma, which are all, the alpha is relaxed, intuitive, creative, and the gamma is that peak concentration. So someone who's in the immobilization is going to be in those delta waves. They're going to be stuck and want to sleep, right? That's that sleepiness that they have. Someone who's in the mobilization, then they're stuck in either the beta waves or the gamma waves. If you go to the next slide for me, Dr. M. Once again, we talked about this last time. Someone who doesn't brain tap is prone to stress, anxiety, some weight issues, mood issues. When you're brain tapping, you're stress-free, you're calm, controlled, and clarity of thought and healthy. If you go to the next slide for me, Dr. M, there's different ways that they use to relax, reboot, and revitalize. I don't want to spend too much more time. So there's different ways we can do this. We'll send you all of this information that you guys can read through. And we just want to make sure that you guys have the information. And if you want to sign up for it, next one, Dr. M, we have, take a picture of this slide. It's the exact same one as the first one, but we want to make sure you have access to this to start using at home daily.
Okay, so here's the big question. What are you actively doing to reverse the adverse pandemic trauma of this 2020 COVID pandemic? And the answer is doing nothing is not going to change it for you. No matter how you responded, if you responded by immobilization, if you responded by mobilization, or if you responded by rest and repair, okay, it's left a trauma mark that you must do something specifically to get it from short-term memory into your long-term memory, just like, the long-term memory of Pearl Harbor, the long-term memory of September the 11th. Yes, those were tragic events, but we've dealt with those. They are not in the forefront of our mind. And so we need to do this with this COVID pandemic. If you don't actively do something about it, you're going to get stuck in either immobilization or mobilization. You're going to be stuck at turned on or turned off, and then it's not going to be healthy. Somewhere down the road, it's going to adversely affect your body. So again, we want you to send the word trauma to 555-888. We're going to send you that ACE questionnaire. Do the ACE questionnaire. Come on in and have us do that heart rate variability and polyvagal testing on you to see where you're at in terms of your response to all this, and determine, okay, what things do you need to tweak, do, start doing, stop doing, so that we can help you. So we're ready for some questions. Scott?
Dr. M, first thing.
Yes.
We did have somebody who said they were not able to get that information, so we're going to make sure we're going to correct that tonight right after we get off the line here. And send it back out to you. So make sure that you still are texting that trauma to 555-888, and we'll make sure you get the information.
Okay, we'll also send a link to Scott so he can email all of you basically a one-page link with all the studies, the questionnaire, the video clips that we talked about, the books that we talked about at the start. So we'll have all that stuff on one page that you'll be able to access. And I'm going to be upfront. Okay, it probably won't get to you till maybe Thursday, but I'll do what I can to get it to you tomorrow as soon as possible. So, but I'm just being heads up front. It's like, okay, Thursday for sure, but I'll try and get it done for tomorrow. Okay, Scott.
Fantastic. Yeah. Do we have any questions? You guys are available. You have the chat box available to you, or the Q&A box. We're watching both, and you're more than welcome to put a question in. One of the great things about Dr. M is he's a very clear teacher. Both these guys, Dr. Chip as well, just very well planned, very well presented throughout the presentation. So I know that often when I've done these types of trainings, the questions are in proportion to the clarity of the material, or lack thereof, rather. So you guys are extremely clear. Thank you for that. Any questions at all that you have? None right now. Let me say this, and you can put your question in. We're going to send you that email. It'll come from Dr. M related to this webinar. I'll be uploading that, putting that together, but it'll come from his name, so to speak. So what you can do also is, if you have any questions when you get those emails, just hit reply to the email. You can go through the material that's in there and just hit reply to the email. We'll make sure the email goes right to Dr. M. And he can field any questions for you, or Dr. Chip may reply to you. So don't feel like the Q&A is over. Some of you that are viewing this may be watching on the video replay of the recording. And so we want to make that available to you as well, that you have that opportunity on any of the emails you've received related to this training, that you can just hit reply, let your question be known, and that'll be followed up with by these two doctors, and they're going to take care of you. So, but honestly, gentlemen, this was extremely clear material, very helpful. Love the statistics, love the data. And I would say, when it comes to trauma and health, everybody on this training now is in the top 10% of the country in terms of expertise, just from tonight's training. That's a lot of great information. Anybody have any questions at all? No questions are coming in. We are at the top of the hour. Would you guys, either one of you, like to make some closing remarks?
Yeah, I would. So I want to thank everybody for joining us. This is something that Dr. Chip and Dr. Diana and I are extremely passionate about. Trauma has affected our life physically, also emotionally, as some of the patients who have come in know. My dad passed away 2 weeks ago. In Canada, we couldn't even get to see him, couldn't go to close his estate. So that has created some turmoil in our life. So we are having to deal with that. So this never goes away. And so I'm imploring you and your family. It's like, okay, you need to take care of these trauma marks that you have accumulated in your entire life. It's not difficult to do, but once you start peeling away some of the layers of the onion, all of a sudden, when it gets to your long-term memory, it'll be like, September the 11th. It was horrific. We all remember that. But you know what? We have seen how America and the world has come through that, how we've responded to that positively. and that has minimized the negative stuff. We need to do that with all those trauma marks in your life, whether they're emotional trauma or physical trauma, like I had my bike wreck, if you had a car wreck or whatever it might be. You need to handle those things because it's a question of when, not if, it will cause other health related problems as you accumulate these trauma marks in your life. So again, thanks for coming. Dr. Chip, take it away. Thank you again, Scott. This was awesome.
Thank you
yeah,
guys
our
again.
pleasure.
I don't have
Our
too much
pleasure.
to add. Just thanks for spending your night with us. And Scott, thank you again.
Yeah, glad to do this. Glad to get this information out. And so again, look for the email with the replay. These gentlemen have a lot to put together, so give them a little bit of time. As soon as we get that together, we'll send it out. We'll have a link to this video. It'll likely be on either Facebook or YouTube. You'll be able to see them in both places. So again, thank you for coming, everybody, and have a great night.